Evaluating a case of primary tuberculosis. Tuberculosis is an airborne infection caused by Mycobacterium tuberculosis. It mainly affects the lungs, making pulmonary disease the most common presentation. Primary infection is the initial phase, occurs in people without specific immunity, generally normal children and young adults, who have not previously been exposed to the organism. Primary infection remains undiagnosed in the majority of cases, as symptoms are mild, nonspecific, and usually self-resolving. Tuberculosis should be suspected in persons who presents with the following symptoms: unexplained weight loss, loss of appetite, night sweats, fever, and fatigue. When the disease has started affecting the lungs, the patient might get symptoms such as coughing for longer than 3 weeks, hemoptysis, which is coughing up of blood, and chest pain. History. It is important to consider demographic factors such as country of origin, age, ethnic or racial group, occupation that may increase the patient's risk for exposure to tuberculosis. Risk factors. When you suspect recent infection, ask the patient whether they had been in close contacts of a person with infectious tuberculosis disease, persons who have immigrated from areas of the world with high rates of tuberculosis, groups with high rates of tuberculosis transmission, such as homeless persons, injection drug users, and persons with HIV infection, persons who work or reside with people who are at high risk for tuberculosis, in facilities or institutions such as hospitals, homeless shelters, correctional facilities, nursing homes, and residential homes for those with HIV. Physical examination. Each and every part of an examination has its own significance. Physical examination for signs of tuberculosis consists of 4 chief methods, namely inspection, palpation, percussion, and auscultation. Inspection. Look for the presence of clubbing of fingers. It indicates advanced stages of disease. Check whether lymph nodes are swollen in neck or other areas. Note the shape of the thorax. Early signs of disease are drooping of the shoulder and slightly less and lagging movement on the affected side. Slight curvature of the spine will also bring about a lowering of one shoulder and apparent asymmetry of the thorax. Palpation. Light touch palpation will sometimes reveal an increased tension or rigidity of the upper border of the trapezius muscle and upper area of the pectoralis major on the affected side. In the early or the moderately early stages of disease, palpation is not apt to reveal abnormalities, except at the apices. Percussion. Moderately light percussion seems to be best suited for bringing out changes in lung resonance. It is easier to percuss from the area of low to the area of higher pitched resonance. Percussion should be the same as to the force of the blow and the firmness. If pleural fluid is present, dullness may be noted on percussion. Auscultation. The method is to have the patient breathing deeply and slowly through the mouth, and at the extreme end of expiration, have him give a short cough, followed immediately by a deep inspiration. If rales are present, they are heard, usually in the first part of inspiration. A good rule to follow is, rales heard above the 3rd rib and the 5th dorsal spine, either side, must be taken as being tuberculous in etiology, until proven non-tuberculous. Increased vocal fremitus may be observed. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.